Now, the South African Human Rights Commission and Gauteng government are currently briefing the media on the state of the Charlotte Maxeke Hospital in Johannesburg. This follows a devastating fire which was disrupted operations since April at the hospital. Now, the hospital says its oncology department will open this week. There have been reports that the hospital failed to make arrangements, however, for alternative treatment sites for the cancer patients who were taking treatment at that hospital, thus leaving many of them in limbo. I'm now joined by Mr. Jack Bloom, DA member of the Gauteng Legislature, as well as Ms. Linda Greef, oncology social worker, and also a cancer survivor, Mum Florence Gonya, who's also a patient at Charlotte Maxeke Hospital. A very good afternoon to all of you, and thank you so much for joining us today. Let's start with you, Mr. Bloom. If you could tell us how the fire at Charlotte Maxeke Hospital just exacerbated the kind of problems that were being experienced at the hospital, specifically with regard to the oncology crisis and the oncology services there.
Well, even before the fire, there was a crisis at the cancer unit. They've got 1,300 cancer patients. There's long backlogs. For the 700 prostate cancer patients, they can wait 3 to 5 years for the radiotherapy. They've got 40% staff shortage in terms of what's ideally required. They're short of 71 staff. And specialist skills, they don't have it. They don't have enough nurses. Chemotherapy is a very specialist area, and they don't have enough staff to provide a proper service there. They admit it. And there's frequent medicine shortages, I think, which is inexcusable in a cancer unit where it's very sensitive to treatment, that you continue with the same medicine. They've even been switching medicines midway through the treatment. They admit that machines frequently break down, and they also admit that the machines are out of date. So that was the situation before the fire. Now it's way, way worse, because chemotherapy patients have been sent to Chris Hani Baragwanath Hospital, and I don't think arrangements there are particularly satisfactory. And radiotherapy hospitals have been, radiotherapy patients have been sent to another city. They've been sent to Steve Biko Hospital in Pretoria. So there's transport issues there as well. And Steve Biko Hospital already has backlogs. So I'm afraid this leads to long delays and extra risks to the lives of cancer patients.
Ms. Greef, what does your organization make of the inconvenience and the lack of services that cancer patients have been put in a situation under?
I'm the chairperson of the Cancer Alliance, and we are 30 cancer NGOs that come together that really speak about advocacy issues and needs in the cancer landscape in South Africa. Charlotte Maxeke and the Gauteng situation has been a long crisis, as Mr. Bloom has just said, and you alluded to. But the crisis with the burn and the fire has made it really much worse, and especially for radiation patients. Because all the radiation patients that were on treatment, more or less 100 plus, could not be accommodated in Steve Biko, which means that their radiation was stopped midway through their treatment. When you stop cancer radiation treatment for longer than a week, it poses a real risk for the cancer to flare up, to increase, and that the patient could have even other cancer forming due to this radiobiological reaction that is caused by the interruption of radiation treatment. Now, this is a severe human rights transgression. It is unforgivable. It is now nearly 6-8 weeks past the fire, and there were some help offered from private oncologists to support the radiation services, and the management did just not take that up. They didn't pursue it. They didn't make it possible. And I think this is a real shame that cancer patients are being treated in this way.
Siyabonga Mum Florence Gonya ukuthi nawe ube nathi namhlanje. Sizwa ukuthi nawe umuntu oya laphayana eCharlotte Maxeke Hospital ngoba uphethwe yicancer. Lo mlilo wase Charlotte Maxeke uphathe njani?
Hayi mina umlilo Charlotte Maxeke angiphatha kahle nix.
Kwenzakaleni?
ngihamba lapho eFort Mateke ne since ngicela i-treatment ngo-April. So khona manje basimuvele eBara. So eBara asithole i-treatment.
Bantshele nini ukuthi fanele niye eBara?
Angizwa?
Bantshele nini ukuthi fanele niye eBara?
Abasitelanga, it's like mina ngifunela umunye usister from eHelen Joseph. Angitshela ukuthi ngithatha amanamba ngifonele eBara. Mangifonela eBara anginikeza i-date nge-21. So nge-21 bengile lapho, mangifika lapho bathi kimi no nize nge-4. Angeke bakhona ngisiza because anikho amaphepheno abo.
Mama, le treatment wena ufanele ukuthi uyithole i-treatment enjani?
Ngithola into i-chemo ye-cancer.
Uthola i-chemo?
Yebo.
So since fanele uthole i-chemo eCharlotte Maxeke, kwaba nomlilo eCharlotte Maxeke, wena wasitholela indlela yokuya eBara, kodwa namanje nje since April uhlezi ungatholi i-chemo yakho?
Angitholi nix, bathi ngize nge-4 June.
Let me ask you, Ms. Greef, we're talking here to Umam Florence Gonya, who is a cancer patient. She found her way to Baragwanath Hospital. Nobody called her. Nobody told her anything. She's the one, out of her own volition, who had to find a solution for her problem. She's a chemotherapy patient. She hasn't been for anything since April. I mean, how does an organization such as yourself intervene in a case like this? Because really, these are life-saving treatments that many of the cancer patients are supposed to be receiving.
Well, you know, we are working on many fields, and we have been working with the Breast Health Foundation to navigate breast cancer patients to services with a bit more clarity. And on the ground, they were in the units really showing patients which way to go. But they were not received with clear communication. The hotline didn't work properly. The drugs weren't available. The pharmacy wasn't geared for that amount of patients. And the stockouts, as Mr. Bloom mentioned, was a big problem. So we have taken this up with the minister. We've spoken to a special committee to address this. And we are keeping on doing that. And in fact, we are at the moment considering taking legal action about this human rights transgression that has been taking place, because it cannot carry on like this. We cannot sit and wait for administrators to do and find solutions which they should have found a long time ago, and now that there's been a crisis like a fire, because it's going to exacerbate the care. And there's no ways that Charlotte Maxeke, even if they open the radiation unit now, that they are staffed, as Mr. Bloom said, to deal with the influx and the waiting list of patients. And remembering that every month you wait after you have the operation, the possibility of your cancer coming back becomes more prevalent. So you should ideally be treated within 3 months after your operation to ensure that you will be able to go into remission. We are talking here about treatable cancers. Breast cancer, you can be treated. Cervical cancer, you can be treated to cure. Prostate cancer, if treated timeously, you can live for a long time with good quality of life and, in fact, go into remission. So there is no.
Unfortunately, we're going to have to leave our conversation there for this afternoon. Time not really on our side, and I do apologize to our guests. We would have loved to have spoken to you a whole lot longer, but unfortunately, we've got to leave our conversation there regarding the oncology department at the Charlotte Maxeke Hospital. The reports are saying that the services are now back up and running, so we'll continue following up on that story to see what the progress is like. Thank you to all of our 3 guests for joining us today. That's Mr. Jack Bloom, Ms. Linda Greef, as well as Umam Florence Gonya.